So in an earlier video, I talked about the 10 commandments of preoperative care, and now we've got the 10 commandments of postoperative care. So stay tuned. 10 things you really need to be aware of as you are recovering from surgery. Rule number 1 is ambulate, walk. Get up and move around at least an hour or so the day of your surgery. And this is not all at once. This is little bits at a time, just walking around the house. This is especially important if you have had a longer surgery where we risk developing a blood clot in your legs. And that's really the reason to get up and walk, is that we do not want you developing a blood clot by just laying around. Rule number 2 is to cough and take deep breaths at least once an hour the days after your surgery. This, for patients who have had abdominoplasties, who have had breast surgery, is really important because your core, your chest is going to be sore to varying degrees. You want to make sure that you're really adequately expanding your lungs to prevent those little lung capsules called alveoli, where the air is exchanged, from collapsing, which can then lead to pneumonia and problems down the road. Rule number 3 is take your pain medicine as instructed. So I like to have patients alternate pain medicine every 3 hours. So for example, at noon, take a narcotic pain medicine. Then at 3 o'clock, take some Motrin. 6 o'clock, more narcotics. 9 o'clock, Motrin. So you're staggering those pain medicines every 3 hours, which keeps your pain level fairly evened out, and we don't go through these periods of almost asleep and then hurting, and then almost asleep and then hurting, and kind of yo-yoing back and forth. Rule number 4 along those same lines is don't drive, make any important business decisions, or shop online when you're on narcotics. Just a bad idea. Kind of like you don't want to drink and drive, don't take narcotics and shop on Amazon. Rule number 5 is don't eat anything greasy or spicy in the day or two after surgery. This is just a common sense rule to prevent nausea. Your stomach is going to be a little bit queasy after surgery, so minimizing really greasy or really spicy foods is just going to help make your recovery easier. Rule number 6 is shower after surgery. A lot of patients are very nervous to get incisions wet. If you have drains, to get drains wet. And for my patients, all of those things are designed that you can shower with them. Don't get in a bathtub, don't get in a hot tub, don't submerge your incisions or drains or anything like that, but you can get them wet. The exception is facelift patients with their big head dressing the day of surgery, and rhinoplasty patients with a cast don't want to get those things wet. So wait till those come off. Rule number 7, and this is not a joke, poop after surgery. Narcotic pain medicine has a tendency to slow down your digestive tract and can make people constipated. It can be really uncomfortable and cause a lot of problems. So make sure you're taking your stool softeners along with your narcotics. Make sure you're getting enough fluid, enough fiber, and make sure that if you haven't had a bowel movement within 3 or 4 days after surgery, call us and we can prescribe some things and kind of help direct you to get things moving. Rule number 8 is do not disturb surgical dressings or drains unless we tell you to. You would be surprised that people actually will remove drains on their own, take off surgical dressings and casts and splints and things like that. They're there for a reason, so leave them alone and let us take those off when they're ready. Rule number 9, if you're in a garment, so for body contouring patients, breast patients, wash it every day. They get gross, they get stinky. Wearing a dirty garment can predispose you to wound infections. So make sure you clean your garment every day, hang it dry, don't put it in the dryer, or all the stretchiness will get destroyed. And if you need another one, let us know. You can get some here in the office. And rule number 10 is don't exercise until we clear you. We have exercise restrictions that are not there to torture you. They're not there to make you fat and make you lazy, but are there so that you can recover uneventfully and that things heal the way we want them to in the time frame that we want them to. So hold off. You've spent a lot of time and money on surgery. Allow your body time to recover before getting back to the gym or getting back on the trails. So those were the 10 commandments of post-operative surgery. If you missed the 10 commandments of pre-operative surgery, you can check those out in another video. And if there are any other topics that you would like to hear discussed on the podcast and the video, please leave us a comment below or shoot me an email, info@drjasonhall.com. Thanks.